Gloria Ramirez was a woman leading an ordinary life in Riverside, California. She was a wife and a mother of two, deeply rooted in her community. Gloria had a reputation for her friendly demeanor and ability to bring laughter to those around her. In essence, Gloria Ramirez was an unassuming member of her community, her life a tapestry of everyday moments shared with loved ones. As the sun set on Riverside, California, Gloria Ramirez faced a terrifying medical emergency. The 31-year-old mother was experiencing a rapid heartbeat and plummeting blood pressure. Her family, gripped by fear, rushed her to the emergency room at Riverside General Hospital, unaware that this trip would mark the beginning of a medical mystery. In today's episode, we will be examining the mysterious circumstances surrounding the death of Gloria Ramirez, the toxic lady. In the bustling emergency room, unease gripped the medical staff attending to Gloria. An oily sheen on her skin and a pungent odor from her breath deepened the mystery. When a nurse drew a blood sample, the air filled with the acrid stench of ammonia. The blood, normally crimson, was a murky brownish hue with unidentified particles. The medical team, seasoned professionals, faced an unprecedented situation. A chilling question echoed: was Gloria Ramirez the source of this enigma, or was something more sinister at play? The medical team was troubled by the unusual observations surrounding Gloria. The oily sheen, pungent odor and peculiar blood sample hinted at something extraordinary. This was not a routine emergency, it was an enigma unfolding before their eyes. Theories were proposed and debated, but none fully encompassed the bizarre symptoms presented by Gloria. The situation took a terrifying turn as medical staff began experiencing alarming symptoms. One by one, they succumbed to dizziness, nausea, and fainting. A nurse collapsed, sending ripples of panic through the room. Another struggled to breathe, while a third found herself paralyzed. The medical staff, now both patients and caregivers, were trapped in a nightmare. The symptoms, ranging from fainting spells to temporary paralysis, defied logical explanation. As more medical personnel fell ill, the gravity of the situation became clear. The emergency room was placed under quarantine. The remaining staff worked tirelessly to evacuate patients amidst the chaos. A team of hazardous materials specialists arrived, adding another layer of surrealism. Their mission to identify the invisible threat and determine the source of the illness. Despite the medical team's efforts, Gloria Ramirez's condition deteriorated. Her body, ravaged by cancer and an unknown enemy, was losing the battle for life. The medical staff watched helplessly as Gloria breathed her last. Even in death, Gloria Ramirez remained an enigma, her passing doing little to alleviate the fear and uncertainty. Gloria Ramirez's death intensified the atmosphere of fear at Riverside General Hospital. The hazmat team faced a daunting task, the invisible enemy elusive. Every surface and piece of equipment was treated as a potential source of contamination. They meticulously collected samples, searching for answers. Six days after Gloria's death, her body lay on the coroner's table. The autopsy, conducted under extraordinary circumstances, revealed a few clues. Gloria's body showed signs of her battle with cervical cancer. Unusual substances, including high levels of dimethylsulfone, were detected. This raised eyebrows and added complexity to the case. As the investigation continued, Riverside grappled with fear and uncertainty. The hospital became a source of anxiety and dread. The media descended upon Riverside, capturing the palpable tension. Gloria's family mourned their loss, compounded by the baffling circumstances. They struggled to reconcile the vibrant woman they knew with the enigmatic figure now known as the Toxic Lady. They demanded answers, determined to uncover the truth behind her tragic demise. Weeks turned into months, and the mystery of Gloria Ramirez remained unsolved. The hazmat team's investigation failed to pinpoint a definitive cause. The unusual substances in Gloria's system did not fully explain the bizarre events. The case became a chilling reminder of the limits of medical knowledge. The autopsy findings provided a crucial lead: unusual substances in Gloria's system. The high concentration of dimethyl sulfone piqued investigators' interest. This discovery added complexity to the case, prompting deeper investigation. Dimethyl sulfone, generally considered safe, suggested an external source. This pointed to ingestion, inhalation, or topical application. The elevated dimethyl sulfone levels ignited research and debate. Experts questioned if this compound could transform into something more sinister. The theory suggested dimethyl sulfone could convert into dimethyl sulfate, a toxic compound. This theory, while plausible, lacked concrete evidence. The official report concluded Gloria died of cardiac dysrhythmia triggered by kidney failure. The illnesses among the staff were attributed to mass sociogenic illness, or mass hysteria. This conclusion failed to satisfy many, particularly those directly involved. Critics argued it was a convenient way to dismiss a complex event. DMSO, hailed as a potential wonder drug in the 1960s, could penetrate the skin easily. This unique property sparked enthusiasm among medical professionals. Athletes embraced DMSO as a topical analgesic for aches and pains. However, growing concerns about its safety tempered the initial wave of optimism. The public's fascination with DMSO transcended conventional medicine. Dr. Pat Grant uncovered a crucial piece of the puzzle. Under certain conditions, DMSO could transform into a deadly toxin. This transformation was triggered by the introduction of oxygen. DMSO could convert into dimethyl sulfate, a highly toxic gas. Inhalation of dimethyl sulfate fumes can lead to severe respiratory distress and even death. This discovery added a new layer to the mystery of the Toxic Lady. The evidence mounts, connecting the dots. As Dr. Grant pieced together the chemical puzzle surrounding DMSO, he realized that the symptoms experienced by the medical staff at Riverside General Hospital aligned eerily well with the known effects of dimethyl sulfate poisoning. This realization was not just a breakthrough, it was a chilling confirmation of his worst fears. The pieces of the puzzle were falling into place, but the picture they formed was far from comforting. The nurses who had been closest to Gloria, those who had handled her blood and bodily fluids, had reported a range of symptoms consistent with dimethyl sulfate exposure: fainting, respiratory problems, and severe headaches. These symptoms were not random, they were a direct consequence of their exposure to a toxic substance. They experienced a metallic taste in their mouths, and even temporary paralysis. These were not isolated incidents, but a pattern that pointed to a single sinister source. The medical staff's distress was palpable, and their symptoms were a testament to the invisible danger they had encountered. The oily sheen observed on Gloria's skin, initially a perplexing detail, could be explained by the topical application of DMSO, which is known to leave a slippery residue. This detail, once overlooked, now stood out as a crucial piece of evidence, linking Gloria's condition to the chemical in question. The pungent, garlicky odor noted by the medical staff, another piece of the puzzle that had baffled investigators, was also consistent with the presence of dimethyl sulfate, which emits a characteristically unpleasant odor. This odor was not just a minor detail, it was a significant clue that helped to confirm the presence of the toxic substance. The evidence, once scattered and seemingly unconnected, was beginning to paint a disturbingly clear picture, pointing towards a tragic chain of events set in motion by a well-intentioned but ultimately misguided attempt to alleviate suffering. The connections were undeniable, and the implications were profound. The investigation had uncovered a web of cause and effect that highlighted the unintended consequences of using powerful chemicals without fully understanding their potential dangers. The story of Gloria and the medical staff at Riverside General Hospital was a sobering reminder of the delicate balance between medical intervention and patient safety. A mystery unresolved. Despite the compelling evidence supporting the DMSO theory, Gloria Ramirez's family vehemently denied that she had ever used the substance. They were adamant in their belief that Gloria, a woman of strong principles and unwavering faith, would never have turned to such measures. They maintained that Gloria, a devoted mother and devout Jehovah's Witness, would never have resorted to using an unapproved and potentially dangerous remedy. Her life was a testament to her faith and her commitment to her family, making the allegations seem implausible to those who knew her best. The family's denial, rooted in their love for Gloria and their unwavering belief in her character, added another layer of complexity to the case, creating a poignant narrative of a family grappling with loss and confusion. This steadfast denial left investigators to grapple with the possibility that crucial pieces of the puzzle might forever remain elusive. The conflicting accounts, and the family's firm stance, made it difficult to reach a conclusive understanding. The mystery of Gloria Ramirez, the toxic lady, continues to captivate and confound, drawing interest from both the public and the scientific community. Her case remains one of the most perplexing medical mysteries of our time, serving as a stark reminder of the limits of our understanding of the natural world and the human body. The case challenges our perceptions and highlights the gaps in our knowledge. While the DMSO theory offers a compelling explanation for the bizarre events that unfolded in that Riverside emergency room, it is not without its critics and remains a topic of debate among experts. It remains just that, a theory. The lack of definitive proof leaves room for speculation and doubt, keeping the case shrouded in mystery. Without definitive proof, the case of Gloria Ramirez remains open, a puzzle that continues to intrigue and baffle those who seek to understand it. A haunting testament to the enduring power of the unknown. The story of Gloria Ramirez serves as a reminder that some mysteries may never be fully resolved, leaving us to ponder the complexities of life and death.